Health Studies Collegium Foundation, the webinar on functional immunology. And I have the privilege of being Dr. Russell Jaffe. I'm a fellow of the American Society for Clinical Pathology, the American College of Nutrition, the ACAAI, the FOCUS, the Clinical Immunology Society, FAMLI, and I'm an overseas fellow of the Royal Society of Medicine. I had a Jewish mother, and I am the founder and chairman of PERQ, P-E-R-Q-U-E, PERQ Integrative Health. And ELISA ACT Biotechnology is a functional immunology lab, RMJHRX, which we'll talk about another time. And I'm an internist, I'm a physician, I'm a biochemist, physiologist, I'm a certified clinical nutritionist, I'm a fellow of the Health Studies Collegium, and I really want to talk to you about your immune system and how it functions and how it can function better. So first to review, the overview. Our immune defense and repair system, our immune system. It's responsible for both defense and repair. When those are in balance, that's good. When those are not in balance, it's not good. Now, I trust you can see, hopefully you can see, that there's a first line, this is on the right side of your screen, a first line innate immune system. And then there's a backup, second line, seen on the left, adaptive immune system. Let's turn back to the right. The innate immune system is responsible for bacteria-killing substances. There are healthy people have compounds that stop bacteria, pathogenic bacteria, in their tracks. And then there are skin protective opsonins. There's mucosal membrane protection. There's innate tissue response and scavenger cell that's recycled. And then, excuse me, then, looking at the left side of the slide, excuse me, you find the adaptive immune system. B-class lymphocytes that produce antibodies. Defense, white blood cells. These antibodies come in kind of two categories, helper and suppressor, Th1, Th2. Which do you want, Th1 or Th2? Which do you want, T cells or B cells? Which do you want, tolerance or intolerance? Now, the last one I hope was clear. You want tolerance, you do not want intolerance. You don't want to lose immune tolerance. You don't want to have an imbalance of Th1, Th2 cells. You don't want to have an imbalance of B and T cells. You don't want to have any imbalances in the body. And the body is based on having an innate first line and then a protective, adaptive second line, which is to confirm to us how important, how really important the immune defense and repair system is. Now, I am a biochemist, so I'm going to get cellular for at least a few minutes. And we're going to talk about the innate and the backup adaptive immune systems. Now, in this case, on the left of the slide are the innate immune cells. These include macrophages and dendritic cells, mast cells, basophils, eosinophiles, neutrophils. And all of these cells overlap, when needed, with the adaptive immune system shown on your right. The B cells that produce antibodies, they kind of look like exaggerated Y. And T cells, both positive and negative, Th1, Th2, balance, 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 ratio, ratio, ratio. It turns out that as we have discovered or rediscovered, there are many things that are important in the body, but many of them are in relation to something else that's important in the body, and you really want to have both. Now let's look at the innate immune system, the microbiome. Now, most people are more familiar with the microbiome of digestion But I want to point out that there are microbiomes in your skin, nose, mouth, lungs, GI tract. Every differentiated part of you has a different colonization of healthy or unhealthy microbes, bugs, bacteria. And we want to eliminate foreign invaders before they get in. And if they get in, we certainly want to stop them in their tracks. And how do we do this? Well, the adaptive immune responses are either cell-mediated, T-cell mediated, or antibody-mediated, B-cell mediated. But if we look on the left of the slide, we see T cells that become migrating lymphoid or immune sensing systems that migrate to lymph nodes, and they are stimulated if foreign invaders called antigens get in. And depending on their state, they'll either produce memory T cells, cytotoxic T cells, helper T cells, or they'll reach out to the other side of the immune defense and repair system, B cells that migrate to lymph nodes. If we're looking on the right side of the slide, that when antigen or foreign material gets in, are stimulated. And then plasma cells form clones, and B cells remember, and they produce antibodies maybe for the rest of your life. But are these antibodies helpful or harmful? Are these antibodies useful or pathological? You can't tell just from measuring antibodies. What we need is something functional, and we'll get to that once we get to the lymphocyte response assay. But I want to point out that measuring T and B cell functions physically, but not functionally, is possible, but confusing, not helpful clinically. And here you see a slide of the immune system. On the far left, you see the bone marrow that produces lymphocytes and other feeding cells, and it goes through the intestinal tissue, the liver, the thymus, the complement system, etc. You have monocytes, granulocytes, macrophages, and these all eventually target anything foreign, from infectious to non-infectious. And now, I hope you see some pretty slides. These are scanning electron micrographs. On the left, you see a healthier natural killer cell that's looking for abnormal cells. And on the right, you see a viral infected cell that this natural killer cell is about to attack. So we want to have natural killer cells. We want to have cytotoxic T cells. We want to have antiviral components in our body. And we want them to target, to identify, and to release abnormal cells. Now, there is a T and B cell response over time. And time turns out to be an important issue. Because as you see in this slide on the far left, the antibody and effector T cells on first exposure have a delay before they recognize and respond. And then they have a prompt response after some variable delay. And then if you get re-exposed after protective immunity is in place, you can have another bump up or down in antibody or T cell function. And this can continue for years. However, it's physical chemistry. It's physical chemistry measuring antibodies. It's physical chemistry measuring T cells. And the problem is, it doesn't tell you functionally what you need to know. It doesn't tell you functionally what the issues are. So let me try to get back to where I think we are. And where we are is looking at the fact that a healthy immune system has no allergies. It's tolerant. It neutralizes infections and allergens. It defends and then repairs. And the point I want to make, and often overlooked by many colleagues, is that there are 50 billion dendritic white blood cells, each able to recycle, break down 50 pathogens per cell. The importance here is that when you have a balance between defense and repair, you're in healthy homeostasis, and that's good. And on the other hand, when you have too much defense continuing and you don't have enough repair, then immune dysfunction and disease result. Now here we look at a very important point. The fact that the immune system has multiple components. And according to Gell and Coombs, the immediate allergies are type 1. These are acute. These are RAST, IgE measurable. These are histaminic. And then you have the delayed allergies, and they're type 2, 3, and 4. We have 3 different backup mechanisms. That's how important delayed allergies are. And delayed allergies are really hard to find by history or serology, history or physical chemistry, history or measuring antibodies, history or measuring cell volume changes. Oh, that's really confusing. So colleagues have been confused, and they've been confused since the days of Gell and Coombs, because delayed hypersensitivities, delayed allergies are hard to find, because those symptoms occur 3 hours to 3 weeks after exposure. And if it's hours to days to weeks, it's really hard to understand. So these reactors drain vitality. These reactors cause problems. I understand that you are not seeing what I am seeing. Isn't that interesting? This is called a stress test for the presenter. It's okay. I'm going to figure this out. And continue. And what have you. I think the message here is that I have been seeing slides advance and others of you may not. We're asking for some help with the technology.
Hi, Dr. Jaffe. They were advancing fine until just a couple slides ago. So.
Oh, okay.
But
well, all good. Let me get back to where I was. That's good. Let me see if I can get back to where I was, which is, where was I? I was over here. Yes, I think I was about here. Before that. We have so much to talk about. Here we go. Okay. Can you see hidden immune burdens, delayed hypersensitivity is hard to find?
No, we're still on the innate and adaptive immunity. If you want, I can just open the slides up and share my screen, and then you can just provide the narration, and I'll advance through.
Yeah, if you wouldn't mind, I think that would be great. If you can open them, and where I am is hidden. And I could sing a little bit of something or other, Judy Collins or Leonard. I'm not sure that my preference in music would be what people want to hear at this point.
Okay.
Right. So where we are is hidden immune burdens. Delayed hypersensitivities, allergies are hard to find. Symptoms occur 3 hours to 3 weeks after exposure.
Can you see, Jayshree, can you see slides?
I can see hidden immune burdens.
Okay, so you, Jayshree, are seeing what I'm projecting?
No, that's what I've got up, Dr. Jaffe.
Oh.
Can you see my slides, Dr. Jaffe?
I can. Well, no, I see mine. I'm
Okay.
pretty sure I see mine, but I can ask you to advance them.
Okay.
So, back at the ranch, Tonto, disguised as a tea bag, is up to his neck in hot water, and we can edit that out. So back at hidden immune burdens, delayed hypersensitivities and allergies are hard to find. The symptoms, the expression, occurs hours, days, or weeks after exposure. So that means that history, which has usually been our important information base in biomedicine, is not helpful with regard to reactions that occur hours, days, or weeks after exposure, because it's really hard to link experience to what's going on. And that's why we decided to do an ex vivo lymphocyte response assay and ask the immune defense and repair system what's going on, and how did so many people get up and go, got up and went, and they can't find it. So if we look at these tests on the top of the slide, you see the older technologies that we don't recommend, and on the bottom of the slide, the ex vivo, the functional lymphocyte response tests, LRA, HSLRA, high sensitivity lymphocyte response assay, HSLRA. Less than 3% variance on blind split samples over decades. Boy, that's pretty precise. Now let's see if it has any meaning. And it turns out that ex vivo responses, lymphocyte response assays, are really helpful. In contrast, the more commonly done physical chemistry, delayed hypersensitivity, antibody, serology, IgG, IgG4, IgA, IgM, antibody this, antibody that cannot distinguish good from bad, that give you a long list to avoid, with many false positives, and many false negatives. So you miss the important T cell reactions. You get positive reactions to antibodies that are neutralizing, protective, and helpful. Boy, that's confusing. And that's why I believe so many tests are not helpful. And then there are particle size tests, automated cytotoxic testing, a device that measures blood particles. It detects anything that's 10 microns in size. So it's not just measuring reactive lymphocytes. It turns out there's lots of 10 micron particles in the blood after clotting, rouleau red cells, platelet clumps, granulocyte debris, actual lymphocytes. Oh gosh, it's a low specificity, low predictive index, low reproducible test. And by the way, if you look for reproducibility, as Hudson and colleagues did, you'll find that this test does not, the ALCAT test and similar particle size tests don't reproduce themselves very well at all. And then we have the MRT test, which is kind of like ALCAT, but reinvented. It measures volume changes after exposure. It's an indirect test. It's not a functional test. It's not a direct test. It doesn't look directly at lymphocytes. It's using an indirect marker to imply a reaction that will confuse you and frustrate you. And by the way, a limited number of items are available. Now, in contrast, lymphocyte response assay, LRA, lymphocyte response assay, HSLRA are available with less than 3% variance on results. Less than 3% variance is as good as we get on a blood sugar or a hemoglobin A1C or a cholesterol. To do a cell culture at high sensitivity is really kind of an accomplishment. And HSLRA, the ELISA-ACT method, directly observes lymphocytes under conditions similar to the body. It's ex vivo. It measures all three delayed pathways. It measures an advanced method with very few false positives, and intolerances, if any, can then be detected because of deeper understanding of what's going on in the immune defense and repair systems. Now, if you look on the left, you see non-reactive lymphocytes under the microscope. If you look on the right, you see reactive lymphocytes under the microscope. I hope you can see clear zones or halos around the cells on the right, but not around the non-reactive cells on the left. It's a very clear test. That's how we achieve such precision, and we've been doing it for decades. So in terms of comprehensive functional ex vivo tests, and looking up online, drrusselljaffe.com, healthstudiescollegium.org, and you can get more technical information. But in regard to these lymphocyte response assays, which are amplified advanced cell culture tests, the ex vivo sample can measure over 500 cell cultures, foods, additives, preservatives, environmental chemicals, toxic minerals, heavy metals, medications, mold, danders, hairs, and feathers, and herbs, all on just 1 ounce, 28 cc's of whole blood. Pretty good. And then we include a personalized recommendation-based health appraisal or assessment questionnaire, the HAQ, Health Assessment Questionnaire, and that helps guide supplements, activity, and environment relationship recommendations. It includes a rotation diet if wanted. It includes a free download of the Joy in Living the Alkaline Way, and you see an image of the front cover on the right. And we urge you to download the Joy in Living the Alkaline Way, PERQUE/ALKWAY is likely to find it. LRA, the Lymphocyte Response Assay Immune Enhancement Program, includes substitute for reactive substances. If something's attacking you, substitute it. Correct essential nutritional deficiencies. Make sure you get enough of the good stuff in and the bad stuff out that reduce defense and repair abilities. Initiate detox mechanisms. Enhance the ability to detox. Alkalinize so that we can survive and enhance human healing responses, which depend upon the alkaline minerals, not an excess of acid. Now we look at comorbid conditions or things commonly found together in addition to food reactivities. And while type 1 are the histaminic immediate reactions, type 2, 3, and 4 are delayed, and then there's digestive intolerances. And notice this long and ever-extending list that might be type 1, 2, 3, and 4, or just be digestive intolerances. And what we want to take away from this is that we should be able to digest. We should be able to assimilate. We should be able to eliminate without immune burden the foods and chemicals we take in. But too many of us are burdened by the immune responses to the foods and chemicals that we take in. Now, where is this LRA indicated? LRA is indicated for immune dysfunction, autoimmune conditions, inflammatory conditions, chronic conditions. Anytime you want to optimize performance and recovery, LRA by ELISA-ACT is indicated. Here's an example. Patient had migraines for more than 20 years. Patient says it's great to be free of them. Indeed, Egger showed that 88% of migraine is due to food-delayed allergy. So we have improved upon Egger's work, building upon that fine work, showing that delayed allergies and migraines are inflammatory, they're autoimmune, they're self-attacking, and therefore we can treat them in the same way we do any of the delayed allergy, hypersensitivity, autoimmune conditions. Here's another example of a person with chronic fatigue. I was amazed by my fast recovery from a 4-year struggle with chronic fatigue and depression. Once I began the LRA by Elizac program, I have returned to work. My energy level and health are stronger than before I got sick. I never thought I could be this healthy. Pretty good. Here's what we heard from Dr. Norm Schwartz, a colleague from Milwaukee, Wisconsin. I found the LRA by Elizac to be the most reliable and effective solution to solving my patients' chronic health conditions. Thank you, Dr. Schwartz. And what's involved in this program is substitute for reactive LRA reactive substances, correct nutritional deficiencies, and enhance repair abilities, then initiate detox mechanisms that remove toxins from individuals, get the bad stuff out and the good stuff in, and concentrate on evoking human healing responses. Now, we've done multiple outcome studies under the following model. If you look on the left, you want to restore tolerance. You want to reset hypersensitivity. You want to move with the arrow on the upper right towards reducing the foreign toxic load on the body. And so we designed a series of studies. The study subjects were recruited and selected. The study inclusion and criteria were there based on substituting for reactive substances, correcting nutritional deficiencies, initiating detox, and evoking healing responses. So what did we find? Well, we did a study in fibromyalgia. A novel treatment for fibromyalgia improves clinical outcomes in a community-based study. In just 6 months, we achieved 50% less pain, 70% less depression. We also found 50% more energy and 30% less stiffness in a best efforts outpatient approach. Now, what we suggest, based on the results, is that you carry out these studies for at least 6 months. And in this specific fibromyalgia study, we normalized the data before so you could compare. At the midpoint 3 months, everybody looks better, but at 6 months, the placebo, the controls are back down to baseline, whereas the primary, the uncomplicated fibromyalgia, and the secondary, the more complicated fibromyalgia, have done even better. So it's important to carry out studies long enough to know what they mean and to recognize the difference between, quote, placebo effects and evoking human healing responses. We also did an outcome successful study in diabetes. And here, loss of tolerance in diabetes with a link to foreign antigen exposure, the title of the article. And we showed in just 6 months, in both type 2 and type 1 diabetics, 2 different studies, a decrease of more than 1% in hemoglobin A1C. And by the way, if you decrease hemoglobin A1C in type 2 or type 1 diabetics, you have just added 20 plus years of quality life at low cost to their lifespan. And in regard to type 2 diabetics, the more common, type 2 diabetics had an 18% reduction in insulin levels in just 6 months. Now, over the last 3 decades, we've had over 70,000 cases with patient and practitioner case successes, and we have published this in Diabetic Medicine. We are happy for you to look at that or contact us for additional case studies so we can show in any specific complex chronic immune dysfunction, autoimmune condition, why we are the better choices. Now let's talk about Hashimoto's thyroiditis, a very common problem. And here we have a person, a 30-year-old woman, diagnosed with Hashimoto's for 7 years by symptoms before she got to the proper professional. Her symptoms included fatigue, muscle weakness, joint pain, weight gain, bloating, and digestive distress. She was treated initially with Synthroid and Euthyrox, a European version of thyroid supplementation. But does this sound like anyone you know? And in this case, the LRA by ELISA Act delayed lymphocyte response test showed 20 items, including nightshade, streptophyton, benzaldehyde, and methylene chloride solvent. The implementation included substituting for reactive items and personalized nutrients, along with an alkalinizing lifestyle program. The outcome. Initially, the energy level dramatically increased, pain reduced, thyroid medicines were reduced, and this person came into their physician and said, "This is the best I have felt in years." Isn't it nice as a physician when you hear someone say that? Here's another example. ED, a 36-year-old woman, 5 pregnancies, 3 children, low energy, 18 kilograms, that's probably 36 pounds or more over her ideal weight, little joy in life, morning temperature often low, below 98 degrees Fahrenheit. Well, if you see correctly on this slide, the total T3 and T4 were, quote, normal, but free T3 was up, normal. Free T4 was indeterminate. TSH was elevated. 2-hour glucose and insulin were elevated. Free cortisol was up. Free DHEA was down. Now, what that means is too much distress and not enough eustress. Too much problems and not enough restorative sleep and restorative neurohormonal balance. A typical overloaded immune defense and repair system. Now, with regard to these overloaded immune defense and repair system, inflammation is really repair deficit. And thyroid glands are attacked, that increase tissue permeability, decrease repair, that causes a loss of thyroid function, and autoimmune or self-attacking thyroiditis. And what we want is to look at the outcome results in regard to the LRA tests and HAQ interventions, substituting for the reactive items, providing individualized nutrients, and alkalinizing lifestyle programs. And in this case, 2 grams of desiccated thyroid in the morning, if the temperature is below 98 degrees, green lights, and various other therapeutic substances were really, really, really helpful in bringing this person back to life. So, with regard to Hashimoto's thyroiditis, in 6 months, the person was asymptomatic, had lost 10 kilograms, had discontinued thyroid hormones, and was well on their way. Now, if you look at ulcerative colitis, a 31-year-old woman, at 10/13, there was a diagnosis of ulcerative colitis. The over-the-counter cleanse triggered bloody stools. Oh dear. They had a large polyp removed from the small intestine as an infant. Oh dear. The mother's diagnosis was IBS, and initial treatment was Lialda. In this case, 18 items were found on the LRA tests. They were substituted as best as possible. Substituting for these items allowed then the induction of repair using the health appraisal questionnaire, multivitamin, multimineral, essential omegas, bone building nutrients, recycled glutamine, comprehensive probiotic, blood building complex, which includes the Percanemia guard, hydroxycobalamin, the under the tongue dissolved B12 before swallowing, and polyphenolics to make the ascorbates more effective. Just a year and a half later, the CBC was normalized, the hemoglobin was 12.9, the CRP was down to 1.14, ferritin was down to 14, still on acetol, but reducing slowly. Weight back up, that's a good thing. Amenorrheic, but breast tissue coming back, that's a good thing. Acupuncture once a month, family healthier, husband lost weight, kids eating healthier, oh boy, and they're going to repeat the LRA test soon. So please call us at ELISA Act Biotechnologies, 1-800-553-5472, or client services at elisaact.com, or look us up online, www.elisaact.com, the double A. And I would really like to appreciate Erica Menerick, Mira Desi, Norm Schwartz, and other colleagues, liaisons, who have put us to the test and found us worthy. I am Russ Jaffe. I'd like to share a little more information during this webinar and then invite you to contact us to see how much help we can provide. What about sleep problems that affect 1 out of 3 American adults? Here we have a 52-year-old Black male who comes for chiropractic care, had neck pain and stiffness with intermittent bilateral fingertip paresthesias, fatigue, poor sleep, and just kind of was tender everywhere. Labs confirmed high cholesterol, triglycerides, glucose, and low vitamin D. The therapeutic intervention was an alkalinizing plan, including the LRA test, avoiding sugar, removing dairy, eating more frequently, grazing through the day, but of high quality whole foods, sleeping 7 to 9 hours per night for repair, and decreasing alcohol intake while enhancing nutritional supplementation. And the nutritional supplementation included the comprehensive multivitamin mineral, the PERK Lifeguard, 3 a day, sufficient to keep the urine sunshine yellow. Vitamin D3, D3 Cell Guard by PERK, has 20 drops at 10,000 IU per day, sufficient to monitor calcium and sufficient to make sure that it doesn't interfere with any blood thinners that people are taking. And then we follow up. Family tends to come to the meetings on 1 week, just 1 week of supplements and dietary changing, sleeping better, increased energy, eating more frequently and healthier, having less problem being alive and well. So, immune system, innate and adaptive. The innate part, repair and cancer deletion. The adaptive part, the supportive additional part, defense and repair. So overburdened immune systems have hidden delayed hypersensitivity, loss of tolerance, delayed allergy, and we want to compare functionally delayed allergy and hypersensitivity tests. Now it turns out it is complicated, and here you see an antigen presenting cell on the far left, the APC, receiving an antigen from outside, and it can end up in a CD8 or a CD4, and it can go through to T cells or B cells, depending on conditions. Kind of complicated, but interesting. If we look at the adaptive immune system, you either have naive B cells that produce antibodies out of clones, or T cells that react directly without antibodies. So it's really important to do a cellular lymphocyte response assay, an ex vivo functional lymphocyte response assay, if you're going to get the right information, the useful information about both B antibody producing cells and T non-antibody reactive cells. Now, what about type 1 allergy? And here you see an arrow to the IgE RAST histaminic type 1 runny eyes, sudden itching, hives, swelling, anaphylactic shock. That's not what the LRA measures. That is what conventional allergists look at. But what we propose is a personalized and individualized report to go along with the information on how to stop these crossover problems. So allergic rhinitis, a case study, looks like type 1 allergy. A 58-year-old woman, since childhood, she had had a perpetual cold, constant sneezing, snuffy, stuffy, running nose, itchy throat. She has immediate allergies to dust, pollen, and grasses. And at 57, she was finally diagnosed with chronic, unresponsive allergic rhinitis, prescribed antihistamines and decongestants that didn't work so well. In this case, the therapeutic intervention was a delayed LRA test, 11 items found. The implementation, as you see in the middle of the screen, was to reduce immune burden by substituting for the true reactors for 6 months for strong, 3 months for moderate, following an alkalinizing, enhancing health lifestyle program. And in this case, the implementation was the health appraisal questionnaire. And if you see the bottom of the slide, The supplements including buffered L-ascorbate, polyphenolics, quercetin dihydrate, and soluble OPC, multi-strain probiotics, magnesium, and choline citrate to keep the urine pH after 6 hours of rest between 6.5 and 7.5. And here's the outcome in this difficult, challenging case. Post-nasal drip dramatically reduced, more restful sleep, and no heavy head in the mornings. 5 months later, different person. No fatigue and seasonal allergies and they have gone. Systematic substitution, alkalinization, and optimized nutritional supplement allowed her to repair and rebuild her microbiome and heal her metabolism or metabolome. Now here's some data from the type 1 and the type 2 diabetes studies. Notice that type 1 and type 2 diabetics have similar reaction to sweeteners, different reactions to toxic metals, environmental chemicals, and additives, and even cow dairy. And please contact us for more details about type 1 and type 2 diabetes and how to better manage those conditions. What about this individual, a 58-year-old woman with rashes and hives? Sounds like type 1. Sounds like immediate allergy. Now these rashes, these hives, blisters on the hand, itching, throat closing, and brain fog had impaired the quality of her life. Delayed lymphocyte response testing, the LRA by ELISA Act found cow dairy, potato, sulfite, and metabisulfite, food colorings, and organophosphates. After 2 weeks of avoidance, reduction in rashes, blisters are gone, significant skin improvements. Oh gosh. How about energy depletion and chronic fatigue? A 50-year-old woman diagnosed with ADHD, treated with Adderall. Her symptoms were lack of restorative sleep, decrease in energy, weight gain, and mild alopecia. The therapeutic intervention had to do with the delayed LRA, lymphocyte response test, immune enhancement program, including all of the things to which she reacted. And what we find is that substitution for the reactive items and personalized supplementation, including multivitamin, repair polyphenolics, bone-building nutrients, adrenal support, an alkalizing lifestyle program, in less than a month, she achieved appetite control. 2 months, sleep rhythms returned to normal. 3 months, no loss of hair, night tremors gone, and actually prescriptions reduced by 50%. And in just another month, 4 months, energy level high, sleeping well, focused on improvement. So these are examples of what you can achieve, exceptional outcomes based on LRA by ELISA Act tests and this comprehensive approach to evoking human healing responses. I'm Dr. Russell Jaffe. On behalf of this approach, I would like to appreciate particularly some of our liaisons and some of our ambassadors, including Erica Menerick, Norm Schwartz, Mira Desi, Brian McGuckin, and others, and thank them for the years that they have put us to the test and found us worthy. So on behalf of LRA by ELISA Act testing, on behalf of PERQ, P-E-R-Q-U-E, Integrative Health, on behalf of BetterLabTestNow.com, on behalf of Health Studies Collegium.org, I am Russell Jaffe. It is my privilege to provide you this information, and may we all find our ways to being healthier and happier.
Thanks, Dr. Jaffe. Do we have time for a couple questions?
Oh, sure. I'm all ears.
If anyone has any questions, you should be able to unmute yourself and ask. If you have problems, then I can go in and unmute you.
Does Jayshree want to ask any question on behalf of the group? Anything that could be clearer or that we could reinforce?
Hi, Dr. Jaffe. It's Erica Menerick. How are you?
Fine, Erica. How are you? Nice to hear your voice, and thanks so much for what you've been doing.
Absolutely. I had a question at the dinner that I did the other night, and I can tell you how I answered, but I'm curious how you would answer it too. The question was about if you have a patient who you're going to do the LRA on, you'd like to do the LRA on, but you're very suspicious of the fact that they probably have a significant amount of dysbiosis. Which do you do first? Do you try to do something with the gut first and then run the LRA, or I kind of said I end up addressing both, but what do you recommend with that, and how do you see as the role between dysbiosis and the immune intolerances that we see on the LRA?
No, thanks for asking the question. And I think it comes down to the difference between how we were trained to look at one problem at a time to try and isolate single variables in comparison to how life really works, the way nature really works, which is in a systematic or systems biology approach. So what I suggest is that people be comprehensive and not differentiated. By differentiated, I mean trying to look at a specific symptom complex and find a specific beneficial recommendation. What we say is go upstream. Look at why people are falling into that river of disease, which is currently occupying 18% of our gross national product and about to make us an uncompetitive nation. So let's go upstream, look comprehensively at LRA by ELISA tests, the health appraisal questionnaire, and see what happens when we put in a unified, in a systematic, in a comprehensive way, such an approach into practice. And as you and other colleagues have found, Erica, when folks understand the synergistic value of doing this in a comprehensive way rather than chasing symptoms, they tend to find even more value in everything else we're doing. Now, did that disagree with anything you said?
No, that's right on track. I think the only other thing that I think I added was that the only other thing I added was that.
Go ahead. No, you go first.
Oh, just that it could be chicken or egg. That the reactive items. The reactive items could be causing inflammation in the gut, or the gut dysbiosis could be causing inflammation that's making the immune system overreact due to leaky gut. So it doesn't matter which one came first. They're both there. We need to address them both.
No, that's exactly right, Dr. Meyer. It doesn't matter whether the chicken or the egg came first. They're both involved. And so we want to take a more comprehensive approach to nurturing both the egg and nourishing the chicken, if you will. So I no longer want to know which came first, the chicken or the egg. I assume the chicken and the egg are both involved.
That's great. Thank you.
No, you're most welcome. And thanks for being an honorable physician who put us to the test and found the value. And we're very grateful for the experiences you and your patients have had, which has kept our lights on over these decades.
So, Dr. Jaffe, I had one question. I had one question for you before you, and can you again explain the helpful and the harmful antibodies? I think that's something that everybody wants to hear a little bit more deeper into, the distinction between the helpful antibodies and harmful antibodies.
No, I'd be happy to make this, and it's a very important point. Somehow the idea has gotten across incorrectly that antibodies are harmful. Or they're either harmful or helpful, but they're helpful when they're helpful and they're harmful when they're harmful, and it's a little confusing. It turns out that measuring antibodies is confusing. It is not recommended. It's a physical chemistry test. But if the antibody is neutralizing, beneficial, and protective, that's completely different than if the same IgG antibody is reactive, complement fixing, and harmful. And the sad truth is that measuring whether the antibody is present and how much antibody is present tells you nothing about whether this is helpful or whether this is harmful. And it's a very important point. So among antibodies, they can be helpful or harmful. So you need to know functionally through the lymphocyte cell culture which are the harmful ones, which are detected by the lymphocytes, and which are the helpful ones, which the lymphocytes ignore. And then, fortunately, the lymphocytes also pick up the T cells, which have nothing to do with antibodies, but everything to do with immune tolerance or intolerance. So we need to distinguish helpful from harmful antibodies. We can't do that with IgG tests. We know they're available. We know they're available from labs. Many labs offer IgG tests. Ask the lab director of those labs which of those antibodies are helpful, which of those antibodies are harmful, and they will tell you they don't know, because you can't know. The test is physical. It's not functional. It's old generation. It's outmoded. It's commonly available. It's commonly done. It's often confusing. It misses the distinction between helpful and harmful. It avoids the T cells. So it has a double jeopardy. First, it doesn't distinguish good from bad in the antibodies. And then, as or more importantly, since the T cells are more important for delayed allergy, it doesn't tell you anything about the T cells. You must have a lymphocyte cell test, a lymphocyte response assay, an LRA by ELISA Act, if you want high precision, to get the information about meaningful antibodies that are harmful, but also information about T cells that are reactive. So we want to be tolerant. We want to restore tolerance. We want to use the immune defense and repair system in an intelligent, functional way. And yes, for the last 50 plus years, people have been measuring antibodies, but we were naive and we assumed if the antibody is present, oh, there must be a problem, or there must be no problem. So antibodies against infections were considered to always be good. Antibodies against foods were considered always to be bad. That turned out to be naive at best, scientifically unfounded, and confusing. So thanks for asking, because antibodies are commonly measured, and antibodies give you useless, not functional information. And I say useless because if you can't tell whether the antibody is helpful or harmful, I'm telling you that information is useless. If you can't tell the meaning of the test, I wouldn't do the test. A helpful antibody protects you. A harmful antibody could kill you. That's a big difference. So let's do functional testing, LRA by ELISA Act. Let's include a health appraisal questionnaire, and let's get to the bottom of these chronic inflammatory autoimmune problems and resolve them. It is an opportunity, and now is the time.
All right, thank you, Dr. Jaffe. Unless there are any other questions, we will be sharing this recording to everybody. There was a lot of great information I'm sure folks will want to go back and listen to. Those, I know there were quite a few folks that wanted to be on but weren't able to join us, so we'll have an opportunity to share the recording with them. If anybody thinks of questions after, please feel free to email us. You can either reach out to Mira or to Dr. Menerick or to myself, and we'll make sure to get Dr. Jaffe's responses to you as soon as possible.
Thank you so much. Look forward to other opportunities to clarify these questions or to fill in any particular.
All right. Thanks all.